And welcome back to American Agenda. I'm Tom Basili. The city of Chicago is launching what they call a two-part alternative response plot program this fall when responding to 911 calls. Instead of dispatching police officers, they'll be sending out a mental health professional and a paramedic. These initiatives come as defund the police protests have ramped up since the death of George Floyd last year. And now in a latest Gallup poll just coming out showing the percentage of black and white Americans' confidence in our nation's cops. Let's bring in our panel for their reaction to all of it. Stacy, I want to start off with you here. Sending these mental health professionals to into these situations where we know in Chicago dozens of people are getting shot, people are getting killed all over the city every single weekend. What could possibly go wrong?
Well, I mean, the mental health professionals have already spoken up back when they were asked about this about almost a year ago. There was a big push to have mental health professionals respond, and tons of them went on television and everywhere else and talked about how a lot of times when they're responding to their own clients, people that they're working with in clinical settings, when they have a call from a family member saying, your client is out of control, my relative and your client is out of control, they will call 911 and ask for a police escort because they want to go in and help the person. But if the person is out of control per their family member's observation, they know that they're not going to get the result that they want without assistance. And, most of the social workers in America are women. So you're talking about smaller stature, smaller muscle mass. So this is a terrible idea to have them responding by themselves. If they're responding as supplemental assistance to our law enforcement, that makes a lot more sense. Mm. But as with all of these things, it's never going to be sensible and good policy because Democrats aren't capable of that.
Stacy, wait, I'm sorry. You said men and women are different. I was just struck by that. AJ, let me ask you. Let me ask you, AJ. Look, these folks are being put in harm's way. They do not have adequate training. People are going to get killed here, don't you think?
Well, I think that's a perspective, but I do think that the mental health crisis that's going on, especially in low-income communities, needs to be looked at. Look, if they're willing to pair a police officer, pair an EMT with a mental health professional who can help in some of these crisis situations, I think that would be great. Now, this all depends on how Chicago sets up this program. Will they make sure that these crisis workers will be safe? Will they make sure they're accompanied by a police officer or by an EMT? Because keep in mind, EMTs are not necessarily trained, the way that cops are to defend themselves, but they're sent to these crisis situations oftentimes as well. Mm-hmm. So there's a way that this program could work. It's just the hope, like Stacy said, will Chicago set up this program for it to do the job that it needs to do, which is helping police deal with situations where the person is mentally ill.
Yeah, and I think there's some merit to that, Congressman. But when I talk to law enforcement, they say, look, anybody that is in the middle of an active setting that could potentially be in the way is a bad thing. A social worker, a paramedic, if they're not ready and they're not prepared to be in an active setting, potentially, then that person can ultimately be an impediment, can also be a danger to the officers on the scene and to themselves. I'm sure you've heard this argument. Your thoughts on this?
Yeah, look, having worked as a general assignment reporter, worked in TV news here in the state of Florida, Houston, Texas, as well as Chicago, sure, it absolutely can be dangerous for everybody. While I believe that there are some great conversations and potential reforms for police officers today, I think that whatever's going on here needs to be clearly thought out because of the dangers that you just highlighted. I also think that, unfortunately, law enforcement today is expected to be everything to everybody. They're supposed to solve domestic issues between couples that are violently attacking each other. They're supposed to literally talk people off of a ledge. They're supposed to try to de-escalate knife fights in, for example, the city of Columbus, where an officer was absolutely destroyed by actors and leftists and media because he shot and killed someone who was about to knife and kill another young girl in Columbus. They cannot be everything to everybody. If this is set up properly, I think it's a good thing. And quite frankly, they should send the person there advising on mental health to the mayor of Chicago, Lori Lightfoot, first.
All right, great discussion. Thank you, panel, and stand by. Coming up, the latest findings involving the Arizona audit hearing when American Agenda returns after this.